I would like to introduce Alyssa. She is an educator and an advocate, and she's working for a law firm. And I'll let her give her the rest of her information, but she's a teacher with experience, and my new best friend. We found that we have a lot of background that we have shared. My name is Kathy Jackson, and I am the mother of a CACNA 1A person who also has two daughters that also have the genetic variation. And I happen to have been a special education teacher for a few decades before finding CACNA 1A was in the family. So I'm at a different experience, a different level at this point in as a retired teacher in the special education process. But I'll let Alyssa start, and we'll have a question and answer later.
Good afternoon. Can everyone hear me okay? Okay. Yes, my name is Alicia Schuler, and I was a former special education teacher. I taught in Loudoun County, which is in Northern Virginia. I was a self-contained autism teacher for grades K through 2. Prior to that, I worked in Pittsburgh. I've taught at the middle school level, the high school level. I have my master's degree. I'm still a certified special ed teacher. And just so you guys know, I had a coworker, Bridget Garrity, who was supposed to be here with me today, but unfortunately, she's extremely ill, so it's just me. Just a little bit about myself. Like I said, I taught in Loudoun County. I was a self-contained autism teacher for grades K through 2. I worked at the middle school level, the high school level. After that, I decided that I just wanted to help more families. Schools are very challenging. And so now I am a special education advocate for a law firm in Fairfax, Virginia, Belkowitz Law. And I've been there for about 2 years. Prior to that, I was an advocate in DC. This is my coworker, Bridget. She was also a former special ed teacher. She worked in Fairfax. So the goals for today's presentation, we're first going to talk about key takeaways, and the key takeaways are based on the IEP, the Individualized Education Plan. Next, just know your rights, and knowing your rights are based on Virginia and Maryland, because I'm from Virginia and I figured there'd probably be some Maryland folks here. I couldn't cover everything. Feeling confident advocating for your child. And then at the end, we'll kind of do some question and answers. So this is sort of the, it's a parent who's trying to navigate the special education maze alone. And, oops. Can you still hear me? Okay, sorry. What do you do? How do you begin the process? Because there's so much involved. And I will tell you, as a special ed teacher, I'm still learning. I learn things every day. I was in the classroom for almost 15 years. So key takeaways. When we talk about present levels, you might hear it, present levels of performance. That's usually the first section in the IEP. And this is the baseline for the goals and the progression. It needs to be specific. So if you have present levels, you have strengths, you have needs, right? I have seen IEPs where strengths are like one sentence and needs are one sentence. But present levels, the needs are where you develop your goals. And so it needs to be very specific. What is your child good at in academics? What can they do specifically? They can do addition and subtraction. Okay, great. Is that addition and subtraction with regrouping? Is that, within 100, 99, like what specifically can they do? And then the needs need to be very specific because, again, the needs and the present levels are where the goals are developed from. It identifies how your child is currently doing, like I said, the strengths, and it also identifies areas where the child's having problems or difficulties, which become the needs. Academic achievement. So we need to have subjects in there like reading, writing, math, but also behavior. I know the previous presenter, is it Michelle? Mary. She talked about, adaptive skills. That also needs to be in here. And then functional performance, so non-academics like communication, how are they with their fine motor skills, behavior, social skills, and daily life activities. After present levels comes the goals, okay? So the purpose, this is, typically goals are developed for an entire school year, right? It's what the IEP team will work on for the next year to help your child progress. If you are seeing goals repeat year after year after year that are the same language and there's no change, that's a problem. It is because the goal was either written and it wasn't attainable. There's lots of reasons why kids don't make progress, and you need to investigate why. Even if you look at progress reports, right, it might say they mastered a goal, but then the goal continues to be on their IEP for the next 4 years. Again, they need to be specific, and we use what's called SMART goals. So the S is specific, the M is for measurable, achievable, relevant, and time limited. So specific, this is where it includes a very clear description of the knowledge and skills that will be taught to address the child's progress that's being measured. Measurable, you can count it or observe it, right? It allows parents and teachers to know how much progress the child has made since the performance was last measured. Achievable, that's the direction of the behavior. Are we going to decrease it? Are we going to increase it? And the area of need. So is it writing? Is it math? Is it behavior? Is it executive functioning, communication, fine motor? And the level of attainment. So do we want them to do it independently? Do we want them to do it with prompts? I've seen goals where it's like 2 to 3 prompts. No, I want you to pick a specific one because that's really hard when you come to when you look at the progress reports. If we're also looking at the number of prompts and there's a range, it's really hard to determine where specifically that child is at. Relevant. This should note the expected result clearly, and it's not based on a district curriculum or state tests. I see a lot of goals written, and they're like, well, that's what they're working on. I'm going to say for the SOL, for the standards of learning, that's in Virginia, okay? The IEP is not, it's specific to what your child needs, not specific to a curriculum or what's being taught. Time limited. It needs to identify a clear deadline when the child's expected to make progress. So it's usually within a year. And it is at regular time intervals. So if you have goals that have short-term objectives or benchmarks, those are usually broken down. I know in Virginia, when we do benchmarks or short-term objectives, they align with the progress reports. Accommodations and modifications, okay? So there's no limit on a number of accommodations a student can have. I can't tell you how many times I've been at an IEP meeting and they're like, we have 4 accommodations, that's enough. Well, the child requires more than 4 accommodations, so what does the child require in order to access the curriculum and level the playing field? Again, they need to be specific. So if we have an accommodation that's, Johnny will get movement breaks. Okay, what are the movement breaks? How often are they? Are they before each task? Are they after each task? How long do they last? An IEP is meant for anybody to pick it up and be able to understand it and implement it. So whether you go to a different school, you as the parent should be able to understand exactly what the goals are, what's being measured, what the accommodations are, what the modifications are. If you don't, we need to come back to the table because everybody needs to understand it, not just the educator or not just the people working with your child. If a student requires accommodation, it must be provided. When I say teachers cannot say that they're short-staffed or too busy, I've actually had that in meetings. I didn't have anybody to take the student. We were too busy. Well, that's a problem because now you're in non-compliance with a legal document. Let's see. Okay, and funding is not an issue for an IEP, right? You might have some times where schools say, oh, we just don't have the money for that, or we just don't have the resources. You know what my answer is? That's not my problem. Special education and related services. So these can include direct services and supports to the child. It can include support staff and training for staff working with your child. There's different types. And then how often, how long, where, and when. So specific types of maybe special education services could be reading instruction, math instruction, behavior instruction, written language instruction. There can also be your special education related services. That's where occupational therapy comes in. There's physical therapy, music therapy, speech and language therapy. Let's see. And then we also need to indicate how often these services are occurring. So I know from experience as an elementary teacher, our service minutes were weekly. Sometimes when you get to the middle and high school level, it's biweekly, it could be monthly, but it needs to be very specific so that you are able to say, oh, you know what, Johnny didn't receive his 30 minutes of speech and language per week for, 4 weeks. That becomes another issue. That's compensatory services, which I'm not even going to get into. And then how long is each session going to last, right? Are they going to get, like I said, 30 minutes of speech and language a week? Are they going to get, 150 minutes of behavior instruction? It's very specific on what the child's receiving, but just remember that the goals tie to the services. So if you see a service and it's like, they have written instruction or they have written language instruction on their IEP, but they have no written language goal, I would ask, what are you doing during that time? Deadlines. So the dates I have listed here are specific on Virginia's IDEA regulations. However, when we get to the access to the records, it says within a reasonable period of time, but in no case more than 45 calendar days from request. A lot of times what I will get when I do a records request or a FERPA request is they'll say, okay, we'll have the records to you in 45 days. That doesn't work for me because I have a meeting in 5 days. So those records need to be presented to you or given to you without necessary delay. If I have a client that signed up with me quickly and it's a quick turnaround, I might indicate specifically what I need for that meeting, and then everything else they can send to me later, but they have to provide you access to those records. They can't just say, oh, we're going to get them to you in 45 days. 45 days is not a default period. Okay, knowing your rights. This is for Virginia. It's probably similar for a lot of states, but it's the procedural safeguards. So you will get procedural safeguards at least once a year, okay? It's usually a big book. All of your rights in there talks about, if you don't agree, due process, mediation, etc. You can also get your education rights by request. If you want them again after an evaluation, I have it often where I have meetings. I could have, 4 meetings with the same client in a month, and each time they send them their special education rights. This one's just for Maryland. It's very similar. You get it upon initial referral or parent request for an evaluation. When the first written state complaint is in a school year, you also get your procedural safeguards. Upon receipt of the first due process complaint in a state or in a school year, when a decision is made to take a disciplinary action or upon parent request, and that's specific for Maryland. So feel confident advocating for your child when you go to these meetings. It can be very intimidating because it's usually you and probably 10 other people at a table, right? That's intimidating, especially if you're new to special education. You want to be polite at the meetings. You want to be respectful, but you also want to speak your mind, right? So if somebody says something that you don't agree with or that it's not an accurate representation of your child, don't be afraid to say, I'm sorry, that's not accurate. You can still be respectful and polite. You want to know what the data says, okay? You want to read the data that's given to you. I make it a point with all of my clients, we request the data on a quarterly basis, sometimes on a monthly basis, depending on what the issues are. And then we review it. And when I come to a meeting, that's not what the data says. The numbers that you have listed in the IEP on how they did on their progress is not what is in your document. And bring your own documentation, right? So you can bring anybody that you want to an IEP. Bring outside providers. Make sure there's collaboration with outside providers. There's a specific section in Virginia IEPs after accommodations where it's like supports for school personnel. I will put in there that I want them to collaborate monthly with outside providers and list those providers. Because if it's not written, if it's not documented, guess what? It wasn't said, it didn't happen. And then you are your child's strongest advocate. Question and answers. So I just want to say something, it's not in my presentation, but if you have a telephone call with anyone from the school, make sure you take notes and you document everything that was said and write it down. Follow it up with an email and say, thanks, Ms. Smith. Thanks for the conversation. Per our conversation, you're going to do X, Y, and Z, or X, Y, and Z is going to happen. Because again, if it's not documented, it didn't happen, and then they can come back and say, oh, that wasn't my conversation. I have parents who take screenshots of text messages. Sometimes teachers want a text message versus put it in an email. They want to do a phone call. Document, 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 because chances are you're going to need that later on if something were to come up or you come in a meeting and they're like, we didn't say that. I can't tell you how many times that's happened when I've been in meetings and I'm like, well, actually, I have the text message that you sent the client. You needed to, you couldn't handle the student's behavior, so you needed them to come pick them up, 45 minutes early. That's the other thing is I have a lot of clients, and even as a former autism teacher, I had a lot of students with behaviors. My job as a special education teacher is to know how to manage those behaviors, provide appropriate accommodations, modifications, redirect, whatnot, not for the parent to come and pick up the child early because I can't handle it. You are shortening, if that happens, the school is now shortening your child's school day because based on their IEP, they're supposed to be in school, I'm gonna say 7 hours, right? If you are constantly being asked to pick up your child because their behaviors are too much for the school to handle, I would call a meeting. It's not acceptable, it's inappropriate. Are there other interventions that we need to put into place? There's something called a functional behavior assessment, an FBA, that usually looks at specific behaviors, what's the antecedent, the behavior, the consequence, and then that information is analyzed and shared with you when you come together as a team, and based on that information, is what we have in place, is it enough, or do we need to develop a specific behavior intervention plan, also known as BIP, to meet that child's needs? So if there's a certain behavior that happens, there should be a certain response. I know that wasn't in my presentation, but I just think some of that's really important to to share?
She has said most of the things that I have looked at and wanted to say. There are a few things I wanted to add. When she said on the present level of performance that you'll have at one of the first pages in your IEP. I'm from Missouri, not from Virginia, but IEPs generally are the same sort of format everywhere, the same basic format. For strengths and weaknesses, come in with your own strengths and concerns, or strengths and needs that your child may have, and make sure that they put an emphasis on those strengths. And the strengths don't have to be they're good at math. It can be that they're easygoing, or that they're friendly and always have a smile on their face, or just anything that's positive about your child. And I would encourage you to have them focus on their strengths, focus on what they can do, because, I mean, we want to get to their needs, but if you're focused on their strengths, then they will look at your child as not someone that needs, but see them as a valuable member of their community, not just of the community in general, but of their community and of their classroom and of their family. And also that those things, the needs that they have, they need to be taught. And that is particularly important for our CACNA 1A children, is that you can't expect, as we've talked about motor planning and all the things that are going on in their heads, you can't assume that a child just understands because they've watched other people do it, that they're going to pick it up. An example is, and my granddaughter's, one of her IEP goals was that she would greet other people, like when she went into the classroom. This was in preschool. But is the teacher teaching that? Someone needs to take her by the hand and say, this is what we do. And how it should be in the IEP, written in as a goal. She did have as a goal, but she didn't list any benchmarks or any specifics on that. So you may need to ask, how are you going to teach my child this? And you can do that in the IEP. If they say, here's a goal, and you go, okay, that's nice, but what are you going to do? How are you going to teach it? When I had my classroom with special needs students, I've taught high school, middle school. I went in this order: high school, middle school, then first, second, third, and then I did kindergarten, and then K1 and 2. But what I would do with the students at the beginning is they would come into the classroom disruptive, first grade, kindergarten, whatever, and we would say, this is how you come into a classroom, and you don't just do it once. You practice it and say, oh, look, you did it, that's great. And you have the whole class do it. I'm not talking about just getting an individual, have the whole class do it. And then repeat it over and over again, because they need practice. They need it to have presented over and over again. Also, talk to them about how your child, earlier I heard you mention bring in a packet of information for a doctor to have if you go into emergency care. I love that, and it made me think about this. I would suggest that you have a packet of information to take in to school. I know that they have all the records. They have all the number. They have all the testing scores. They have that thick packet of everything that they've done with a child. But if you take in a packet of information that humanizes your child, which is what we heard several other presenters say today, tell them how your child best communicates. Tell them something specific about what motivates your child. Because what the teacher should do is a give them a behavior, reinforcement menu, and ask them, what things would make you want to do something. And so if you go in with some things like that, so I have a few ideas that I jotted down about what you should have in that packet of information. If you're interested, let me know. I'll share that. The other thing that I noticed this morning was, as we talked about the process, how to process in medical situations. That can be adapted to school also. If you're in an IEP meeting and you're feeling stressed and things are not going well, first say, I'm not feeling heard. The second is, this plan is not going to meet his or her needs at the level where they're functioning. And then the third thing is ask for a patient advocate or ask for a school advocate. That's what I would suggest.
Schools will not have advocates.
But you can ask them to tell them that you need one, tell them. And that's where the procedural safeguards that Alyssa talked about is in there. And it's a thick packet that you'll get that has, you have to sign each time that you get one, and you'll be given one every time you have a meeting. And if you have 10 meetings a year, you'll get 10 copies of it because they're required by law to give you the procedural safeguards. And that will have the information about what to do when you specifically need extra help. Go ahead.
Does the guidance counselor help in schools?
Yes, but it always depends on the school. And that will vary from school to school, even within a specific district, of the information that they have and the guidance that they can provide. And as I was listening to the testing, realized that testing in schools is different, and unfortunately, over time, I started a long time ago, and we had a wide array of tests that we gave, and the teachers gave the tests. And so we had to be trained and qualified to give them. However, no matter how qualified you are, as Mary mentioned earlier, sometimes you will feel the test is not valid. And so you always want to make sure that the person that is given the test will say that. The difficulty in public education at this point is that schools have narrowed it down to 1 or 2 IQ tests, 1 or 2 achievement tests, and then speech or language test if they feel necessary, and then OT or PT if that's needed. That can be scant information, especially if the IQ test is not a specific one. Way back in the dark ages, in the 70s, 80s, and early 90s, we had this access to 100 different tests, and you would see a specific child, and you would know, I don't think that the Wechsler is going to be the best test for this child. I'll go with the Stanford Binet or go with something else. And they don't have that freedom now. So it's not the people that are working there, it's a decision made up the chain of the ladder. But that's what they have available. You can ask about different testing or get outside testing.
Can I just add something really quickly? I think I know I had to skip over some of my slides about special education, but this is great. Like these, I think many of the things that I would have said. One of the things I wanted to say and add was to provide a copy of that neurodevelopmental or neuropsychological evaluation to the school. And unfortunately, even if they have it, they don't always read it. And again, it's not a teachers are busy, the reports are long, maybe some of them are hard to read, but there are many times when I've had a family say, or when I find out a few years later that no one at the school actually read the report that was provided. So
and that's
you can put in the IEP each new teacher must read this report each year, something like that. So.
And that's why I thought of the suggestion as was made about a medical folder. Take in some information that's going to humanize it, and if you can put it like in bullet points and make it just quick and easy so that they will be able to scan over it. Teachers will tell you, too, as you were talking about doctors, this is new to teachers as well as it is to families and to everyone. And I think someone said, I don't need you to know everything, but I want you to be open to learning new things or learning about what can best help my child. Also, build a team and make sure that you have a good team of people that communicate with one another, and you can even put that into the IEP, that there's communication.
And I think it's, like I said earlier, I think it's extremely important for everyone to collaborate, outside providers, school providers. One thing I wanted to note when we're talking about, IEPs or evaluations, the school has to consider outside evaluations. They don't necessarily have to use that data, but they have to consider it in developing present levels. And I always ask at meetings, has everyone here read this report? Has everyone here read my child's IEP? You also want to make sure that everybody in the meeting has actually worked with your child. I can't tell you how many times I've gone to meetings and they don't even know the kid's name. It's not effective for that person to be there if they have nothing to contribute. Just one other thing when we're talking about goals and present levels, you want to make sure that there is baseline data in the present levels. The baseline data is what starts the goal. So if you have a goal and it's like, I'm just trying to, 80% he'll answer, addition and subtraction problems with 80% accuracy. In the present levels, it should say where your child is currently performing that skill. If it doesn't, how did they come up with 80%? You want to make sure that there is actually needs that are tied to a goal, because I have written lots of IEPs, but I've also read a lot of them, and there will be goals in there, and I have no idea where it came from. Like, where did this goal come from? There's nothing in this IEP that is even remotely suggestive that the child needs to work on this.
Do we have any questions? Okay. Sorry, we've spoken so long.
So mine first is, it's not really a question, it's more of along the thought of bringing a bag and other things, is my son Avery, he talks a lot to me and my wife. Yet he doesn't talk at school.
Yeah,
so
that's
similar
familiar.
so similar to what Allison said earlier, when going to a hospital with Sammy, show your educators and your therapists a video of their baseline at home.
Exactly.
Because otherwise, they may not even get into a situation where they start learning if they can't get to that point where they're at their home baseline. And often the teacher and therapist need to figure out how to break those barriers to try to get that same behavior you can show them that they have at home. So
and
I highly recommend that.
Specific anecdotes that you can tell about a goal maybe that's written in the IEP, like if they're not seeing it, walking upstairs, for example, have a picture showing, yes, they're doing it. We've had a physical therapist that said, no, they can't do it. We have some pictures there showing that they can. So that, and also make a list of their progress. Okay, last year they were doing this when they came in, now they're doing this. And if you make that concise and in there, they don't have to read through a lot of information, but they can see that the child's made progress.
Okay, so I don't have a question, but I just wanted to add some things because I also work in special education. So I think that you guys hit a lot of really good points, but I just wanted to share some examples of my experience as a parent on that side of things. So one of the things I was thinking about was if you feel like the hour or whatever time that they've booked for the IEP meeting and you are constantly going over, do not feel bad about either asking them to schedule a follow-up meeting immediately or adding more time if it's consistently over that hour when you're in the IEP meetings.
Exactly.
Because you don't want, it's by law, they have to go through everything with you, and you don't want to feel rushed as the parent.
Right.
The other thing that I would say is, so I'm going to use some examples. Both of my kids have had IEPs since birth. They went to IFSP and then to IEP. With my son, he has a lot of issues with emotional regulation. And so they would do, he has to emotionally regulate whatever the goal was in the classroom. But when are you testing him? Are you testing, he's met his goal, but if you're testing him on a good day, well, of course he's gonna be emotionally regulated because you're observing him on a good day. You need to observe him at a time when he's dysregulated. Can he use those tools in moments when he actually needs them versus just when he's doing something he wants and preferred activities instead of unpreferred activities? So that's really important when you're looking and thinking about the IEP goals. And I would also just throw out there when they start talking about, oh, well, they've met all their IEP goals, like we can take away the services. Do not let them take away everything at one time. Please do not let them take away, because they didn't even tell me. They were like that they had stopped doing things in the classroom, and then all of a sudden he's eloping out of the classroom, he's getting up on the tables and dancing, he's not listening, like he's running around like with it, and just don't let him take away everything at one time, slow, taper it off, because then that's when they really get dysregulated with things, and it ends up very badly all the way around.
I just want to take a moment and let you know we have 5 minutes left for the session, so unfortunately it's kind of a hard stop, but if you wanted to move the discussions out 100%, because it sounds like it's a great conversation, but I just wanted to give you a heads up.
I have a question. This is something that's been happening for like the last 2 years in our district. So June is testing month for incoming kindergarten students. So all SLPs, OTs, PTs within our district are housed for 2 to 3 weeks doing the testing. And it always becomes drop of services for my daughter. And we are getting tired of fighting with them because she's supposed to be having those services. It's the law. But they're, oh, we're running out of time or this and that. So I'm at a loss of how else to fight them other than sending them an email at the beginning of May saying, I know this season's coming up and what are we going to do about it? I don't know if you guys had any suggestions because it's just becoming a repeat thing in our district.
Tell me again about how they're arranging all the testing part of it in June?
So we're in New Jersey, so they do kindergarten testing in our district in June. Yeah, and it takes 2 to 3 weeks.
Wow.
Yeah.
Wow, that's unusual. Yeah, I think an advocate is probably, don't you think so, Alyssa?
I would agree. Yeah. I mean, if you've had that over and over and they're just not listening to
They're
you.
just not doing the services. They just drop them, or the speech therapist doesn't have time, this and that. Yeah.
So what you're saying is your daughter's not getting the services that are
Not getting
outlined
the
in her
services that
IEP?
she should be because they're pulled into the testing, then they have to write the reports.
Okay,
and
so that becomes an issue of non-compliance, and it becomes an issue of now you're going to be asking for compensatory services because they failed to deliver the services by law that they agreed to. So it could just be like figure out how many hours she missed and say, okay, she missed these hours, you are required. I mean, unless if they're just not doing it because of testing, that's not acceptable. And she's entitled to compensatory services because they failed to provide the services that are by law required in her IEP.
Can they add that into the extended school year since that
So
is-
compensatory services are not allowed to be delivered during the school day. So a lot of times that happens, right? I'm like, nope, you can't do that. So I always ask for an outside provider because it becomes a trust issue, right? Like if you couldn't do it in the school year, if you couldn't do it before, why do I trust that you're going to deliver the services that you failed to do before? Sometimes for ESY, they'll want the student to come before ESY or after ESY. That becomes a bit of an issue if we have kids that the stamina, right? So I would just come up with, how many hours she missed. You want compensatory services. Typically, compensatory services are not hour for hour.
Okay.
However, I always ask hour for hour when it comes to OT and speech because a lot of my students, they receive it in the one-to-one setting.
Yes. Yeah.
Always start with the high number because they are 9 times out of 10, the school district is not going to agree to that high number, but tell them, these are the hours that she missed. We're requesting compensatory services and we're requesting an outside provider. It's usually going to become an IEP meeting because you'll have to discuss that and then it will need to be documented in the IEP.
Okay. Okay. Thank you.
And you can ask for that meeting or that directive at any time. I mean, you don't have to wait until next June to do that.
I just want to add really quickly, I completely agree with the idea of an advocate. And just listening to you talk, special education is it's a legal issue. And there's so many words that are written in the legal document that are key words that you've been using, like free and appropriate public education or least restrictive environment. And when you know those words, or you have an advocate who knows those words, that can be really helpful in getting the services that your kid needs. I think each state, I know in Ohio, and I'm pretty sure in other states, there's usually a document published by the education department that's specific to your state, that's written in plain language instead of legalese. And that can be really helpful if you can find that document to give you some of that knowledge and those words to use.
They also probably have a complaint board too if they're really not listening.
That's true. If you didn't hear complaint board, there is. I would give them fair warning and that's what you're thinking because sometimes that will just resolve the problem.
Okay, we have to stop because they need to set this up for our party tonight. But these 3 ladies, I'm betting, are willing to be out in the hallway if y'all have questions.
Yep.